Welcome back. Childhood obesity affects about 1 in 5 children and remains a significant health concern nationwide. Experts say it's important to address struggles with weight management as kids transition back to school routines.
Dr. Alaina Vidmar is the medical director of obesity medicine and bariatric surgery at Children's Hospital Los Angeles, and she joins us now with what families need to know. Good morning. Thanks so much for joining us.
Good morning. Thank you for having me.
So can you define what pediatric obesity is and the factors that contribute to it?
Yes, absolutely. So I think the most important thing to know is that pediatric obesity is a complex chronic disease that is not the fault of the patient or their parents, and that really it is multifactorial. It's genetics, environment, biology, and it really is differences in how the body controls when you're hungry and when you're full, and how your body uses your calories for energy that results in a kid gaining weight faster than they're getting taller.
And is it a certain percentage of weight that they're over what they should be? Because I think a lot of times people don't know what's the difference between just maybe being a little heavier and being obese.
Yes, great question. So we do use growth charts, which help us to understand how kids are gaining weight faster than they're getting taller. A lot of times we'll use body mass index, which we all know is not a perfect metric. But I think what's important to understand is while we use these specific cutoffs to help us understand, what we're really looking at is risk over time of developing other life-limiting complications like type 2 diabetes, high blood pressure, high cholesterol that can really limit life of these kids.
And Dr. Vidmar, when it comes to weight, it can really have an emotional impact when it comes to kids. So as kids are going back to school, they're so influenced by what they're seeing online and their peers. How can we as adults have a better conversation with our kids about weight management without saying you need to be skinny?
It's such a good question, especially I think as they're transitioning back to school and it's a time where routines are changing. So I think parents are such a great support of helping kids understand that it's not about the size of their body or the number on the scale, but that we want them to be healthy long term. And we're really just trying to set them up for the quality of their life and for their health over time. And that's really why we care about these cutoffs or why we even talk about the size of one's body.
So how do we as a family create, a healthy home environment that will then translate to them making healthy choices?
I think a lot of it just starts with the basics. So things like sleep and movement, healthful eating, even if that's just thinking about how much water you're drinking or how much protein you're getting. I think sometimes we make it very complex instead of just thinking about kind of the basics, which can really translate from home to school and other spaces that these families dwell in.
Weight loss drugs, a big part of our culture right now. Are kids turning to that? And at what point do you have that conversation that maybe that is the option for your child?
So the care of pediatric obesity has really evolved. I think a lot of that started with the American Academy of Pediatric Guidelines in 2023, and we now have FDA indication for using obesity medications in kids as young as 12. And so as our toolkit expands, we can really use these medications, and that's where programs like we have at Children's Hospital Los Angeles can really help us to create comprehensive care programs where we can deliver these medications to the kids who really need them.
All right. Thank you so much, Doctor. We appreciate that. It's such a nuanced topic, and I think so many parents are even afraid to have that conversation. So thank you for coming and speaking to us about it today.